We're gonna start with a little bit different approach. My name is Christopher. I work as a service designer at Objectivity, which is an IT company, and I'm more than happy to share my perspective with Jane.
Hi, I'm Jane Coyne. I'm a midwife by background, and I'm leading a. I don't know. Can you hear me?
Yeah, we can.
Yeah. I'm leading the tobacco dependency treatment program for the Greater Manchester Health and Social Care Partnership.
Yeah. So I want to start with two main issues here. The first one that I strongly believe doesn't work. So it doesn't work. I need it to work. Much helpful. Yeah. So patient centricity is not enough. Today's products and services are too complicated. We can't only look at them from one perspective. We can't only analyze them and research the part. That's scary. The part that is patient-centric and patient view. So that's one thing. The second thing is, come on, we need to switch our perspectives from looking up to a vision, to something that's big, that's something that might be, that's something that we are dreaming about, and we need to really switch it and shift it to something that's actually happening, to the mess that is underneath the surface of the vision, to see all the streets, cars, pedestrians, everything that's happening down there, because this is what we are going to work with, not the cool vision of the cool building. And we're going to talk about service design, not UX design itself, but service design, which is a discipline that is still quite new. The first few definitions come from 1999. Of course, I'm not going to go through them because it's not the topic of the discussion. So if you are interested in it, please deep dive. What I wanted to say, it's still evolving and it's still not settled. For the sake of our presentation today, we would like to look at service design as a deterministic process that navigates you through designing new or redesigning existing products or services, and is based on user and business research to deliver three things: value, revenue, and better experience. And this is what we are going to do today, to say it holistically. The last introduction slide, I promised. So UI design is incorporated in UX design, and service design is an even wider thing here, because service design is also about physical world. UX design concentrates on the digital world very strongly. Service design broadens perspective to look at the problem and the issues we are going to talk about holistically. So the first thing in every project is the problem, and the best person to talk about the problem is Jen. She has the problem. So the floor is yours.
Yeah. So obviously we've got this wonderful program that's research-based, and it's got the evidence to deliver a significant reduction in tobacco dependency within secondary care. My biggest problem is that I don't know what's happening physically out there with the data. So I can't see where the challenges and barriers are to my program. I can't see how effective it is. It's really time consuming for staff to get involved, and it's often collecting Excel spreadsheets, paper, multiple ways of collecting data, and especially when you've got 10 localities, 10 or 11 different hospitals, all trying to pull data and get across to you. It's a real challenge to really understand how that's working, not only for us as staff and delivering the program, but also for our patients. So how's that data flow working? Who we capturing? Who we missing? What's our challenges and barriers to actually doing some of that delivery? And then what's our performance in that look like? So multiple problems, Chris, shall we say, in a really complex program.
Yeah, so the idea we are going to share here, it's two perspectives. So first of all, Jane perspective, and very rarely client approaches our division, our company with a very narrow, very boiled down to the perfect frame problem. You rather come with symptoms, you come with ideas, well, you come with itches, and you need someone to tell you where to scratch and how to scratch it. So the first thing is about delivering the full process of understanding of the discovery to figure out what the problem really is. So of course we are going to share a case study today. We are still, the project is still ongoing. So we are after the discovery phase. and we are now trying to reach out to the next possible step that we are going to solve Jane's problem. But this is the story about finding the problem, how we did it, and why we think it's the right way. Not the only way, but the right way for us. So actions. First of all, steps from program manager's perspective are quite simple, right?
Definitely. I mean, we've worked together before, haven't we? So we've also done one project. So I knew the company, inside out. I knew that they could deliver what we wanted to deliver. Obviously, it took us a while to describe the problem because I don't think we're really 100% sure what that is. And I think we're still kind of working through a little bit of that as we speak. I think obviously all agreeing an approach and getting the people around the table, like somebody said before, getting our clinicians around the table, getting different stakeholders to all come in and be part of this is absolutely key. And creating those workshops is essential. We really took the time to sit down with people to really understand the niche bits of each individual stakeholder, how that fit into that wider problem. And then obviously making sure we agree with the outcomes at the end as a team, rather than just you as an organisation or us as the programme.
And that's quite straightforward. However, what we rarely talk about again is the mess underneath that. Remember, switch the perspective. So on my side, it's not so easy. So whereas Jane has like 5 steps to do, I as a designer, as a leader of the problem of the project, I have like 15, 16 or 50 or 60 things I have to do. I have to recruit the participants. I have to figure out the workshop. I have to prepare conduct the workshop. I have to prepare the initial reports from that. I had to check with Jane, with the team, to correct some typos and so on and so forth. A lot of things that are going to be done. So the idea here is that it's very important to share what's happening to the client, because very often clients say, okay, what's taking you so long? What's cost so much? What's the idea behind why we can't meet every day? It's like we discussed it today. It's only a week of work, and in like 3 weeks, why? What's happening? And it's very important to share this perspective, what I'm going to do. And Jane was a part of every meeting we had, almost every meeting we had. So after each workshop, Jane was on our summary of the workshop. You were there saying, okay, from my perspective, this worked or didn't work. After each workshop, we are able to improve next sessions. We can tweak, but still, there were some improvements which were very, very important, either on how we facilitate the workshop or how we introduce the problem to the action.
Yeah, or even who was in the room with us.
Yeah.
I think it was a bit of learning. Did we have the right people there? Is there somebody else we should have had? Who else from a different organisation or a different group needs to be around that table?
So when we boil down to what we do, it's an accelerated 2-step process. We need to find the right problem and then solve the problem the right way, right? That's quite simple. So how come many people really, really fail on step 1? It's because our business is wrongly perceived as a creative business. It's not about wireframing. It's not about just figure out what's the solution and selling it on the really colorful high fidelity mockups in Figma or any other tool, which is the outcome, of course, but people don't see that first. Before we even start thinking about what is the solution, we need to think about what's the right problem. And this is what we happen here. So Jane came to us and said, hey, I've got this problem. And part of the company was saying, okay, we need to figure out how to do this and that. And I said, no, stop. We need to figure out what the problem really is here. So, of course, we've conducted workshops. It was quite simple. We get it online, which is the value that we bring here. Of course, I don't have to introduce the mirror for you. Everything was designed with Jane. So she saw, okay, this is what we want to do. And she accepted how we want to do it. The cool thing is that once we were on the workshop, we were able to really engage with participants. We were able to work in the hours that they were the most convenient for them. And sometimes we were able to split the sessions into consumable chunks for them, because they will, for example, they won't be able to spend the whole day with us just for a few hours, a few minutes here or there. So what's your perspective on the workshop? How do you like it?
I think they were brilliant. I think it brought everybody around the table, and I think considering we did this like during the pandemic as well.
Who? Me or Jane? Yeah. Jane.
that better?
Yeah,
great.
Cool.
Yeah, I think from our perspective, the workshops were fantastic. I think it got everybody around the table. We were doing this in the pandemic as well. So to do something so agile and iterative during that time was absolutely, to come out with something so valuable. It was amazing to do that, and knowing that people wanted to give us their time as well to solve a problem. I think when you talk about clinicians being busy, I think when we know that I think it was Paul before, if you're spending a third of your time actually, on IT and you're really struggling with that, to reduce that and have something that will be beneficial, then I think actually draws clinicians into that discussion as well.
Yeah. So we've managed to do a few things in workshops. First of all, we wanted to build a persona of different stakeholders groups. We had clinicians, we had secondary care units, we had stop smoking advisors, services, pharmacists. We have commissioners and people responsible for the app. And we managed to do persona with each one of them to map the process from their perspective, and also to map the data flow that we need to for the Jane's solution to work. The cool thing about the online workshops was that once we get the issue with getting the right participants, we reach out to Jane saying, "Hey, I think we've misunderstood here, so we need to redo one session with the proper participants right now." And Jane said, "Okay, it's not going to cost a lot of money because the workshops were repeatable. It was just about finding a time for another stakeholder group. So it was quick and easy. We knew we can do it like an hour and a half, not in 4 hours." And I said, "Okay, Jane, but we won't get everything." She said, "I know, but we'll get something." So she already understood something is better than none, which is very, very helpful because you were the part of redesigning it. So the outcomes, this is the view of the mirror board from every workshop there was. So, of course, as you know, we took Jane and her team on a ride without seatbelts, really, because after each workshop, it was like, okay, so this is what we've done. What are your comments on that? What can we add to that? How does it alter our next approach there? Yeah. And then, of course, we can't show something like this to the main sponsor of the project because Jane is our main stakeholder, but she doesn't have the money for it. She has to go to someone else and to someone else and to figure out, okay, so what are we going to do? And Jane said, we can't show it to anyone there because they don't know the process, they don't understand what's behind it, and it's just a mess. She knows how to go on this mirror, but we needed to prepare something else. So we did that for Jane. The cool thing was that this is still not good enough for Jane, main stakeholder. So we said, it's very simple. And Jane was kept challenging us, oh, it's not good enough for me to go further. We need to redesign it. We need to be designing in mind with my boss. So we figure out the customer journey. The important thing is we haven't spoken to patients during our project. That was the decision that you and your team made. Okay, so a few words about the customer journey, please, from your perspective.
Yes, we already knew where our customers were going, if you like. We know our patient flow, we know our pathway, we know the evidence base of what we want to deliver. And we knew if we get the data right, then probably the patients are going to get the best outcome. So we know if they're picked up straight away and they're seen by the cure teams and the interventions are delivered in a timely manner and they're discharged with the right medication, the patients are going to follow that. Then they're not going to kind of diverge from that. So by sorting out our pathway would totally kind of deliver a better patient journey without having the patients involved. And I think this was more about our digital journey for the staff, to making sure, like you said, they've got the tools to do their job in the right time frame and not being overburdened with IT and clunky systems and multiple systems. So, yeah.
So very often UX research ends up with customer journey. Here, we can't build a customer journey or the patient journey without the patient. That would be fraud. You can't do it. I often say, people ask me, okay, so can we build customer journey? Okay, so let's reach out to customers. No, we can't do it. We don't have time for it. We don't have the access for the patients, for the customers. We can't do it. So I said, how do you want to do it? And before our project, Jane said, oh, let's don't talk with patients. We know what's happening. I said, okay, but this has to be a decision. This will come with a cost, of course, and then we have to figure out what's happening after that. She said, okay, let's do it like that. So we try to reach out to the to different teams, different stakeholders, different actors in the system, and we understood their perspective. At the end of this project, patient journey was our common denominator. That's the expression in English. That was access for the whole project, that everyone understood, okay, so this is where am I in the patient journey. But we can't oversimplify it to this. So what we've created is something much more deep diving. So what we did here, we've prepared a customer journey based something that might be called a service blueprint, not per se, of course, but every step that every actor, every stakeholder does was put and illustrated in the context of customer journey, of a patient journey, so that everyone knew, where am I in a patient journey? Because our stakeholders, our actors weren't aware of the patient journey. They don't care about it. They care about their perspective, about their process. They don't know what's happening after they hit apply, continue, close the EPR or any system they use. And is it the wrong approach? No, they're just overwhelmed with job. There's too many jobs, too much to do, too little people, not enough money, they're underfunded, everything is happening. And how can we make this all information help to understand what's Jane's problem? So of course, we are not that smart. I believe that if a designer is the smartest person in the room, you are in the wrong room. You have to be the one who makes possible for everyone else to make the best job. So we made a pact with Jane at the beginning of the workshop of the project. I said, I'll be asking the most stupid questions there are, only to cover everyone's perspective. I'll be asking once, twice, 3 times the same question to different people. And you will see that they will have different answers in their head. Then Jane invested so much time in the workshop because she was present on every workshop. She knew what's happening. We had recording. And I don't believe anyone from the team watched the recordings. They were like,
probably not.
Probably not. Probably not. So we knew that it's very, very important we had Jane as a program manager, because she was learning during this workshops. So of course we figured out what the problem was. We've used the most common approach. So how can we? Of course. So we've approached Jane with 4, 5, or 6 different how can we problems, because of course, as you probably know, it's not like these problems that you have at the beginning. You come and say you start, oh, it's just here, my arm, my foot, and my hair. It's not enough to determine what's the real problem. So we've come to you. Do you remember the meeting? It was like, these are 5 options. And we started to boil down in discussion, like it was me, it was Agnieszka, it was you, and it was Nicola. I don't know if Dan was there, but we were discussing, okay, what is the main problem from your perspective? How do you recall this meeting?
Gosh, it feels a little bit like it was really simple. And I feel like just having one sentence on there doesn't quite cut it. You know, I feel like there was 1,000,001 how can we's and what is our problem. But I think what was really good is we got everybody's perspective. Everybody had a say, everybody was listened to. And I think I still feel like I'm a Virgo, so I do have a bit of control. I'm like, just doing it my way. But yeah, it was just a really good chance for us to all get together and come together to look at what is our problem. I think still we're not quite 100% there, but I think multiple. But yeah, I think it was a good place to start.
And this is a very important thing. I'm very happy that it came up. We are still not there. Even we've agreed on something, it was good enough for us to move forward. But done is better than perfect. And this is something that is very hard to translate to many stakeholders. People want to do it correctly at the first approach. You can't do it. That's where iterations come in place. So we've reached out here, and as you can see, it's not about user experience. The problem that they started with, okay, I need some new tool, ended up with, we need to streamline the admin work so that it will be less time consuming for the team to improve the data flow to deliver better program maintenance and patient experience. But we've identified that this admin work was the main problem. And you can't see it from your perspective. You just see, you don't have the data. And once we were discussing with different stakeholders, different actors, saying, what's the problem? Why do you don't get the data? They said, I don't have time for it. I have to go to another patient. I have a mission. NHS is mainly hero-driven organization. People just have a mission. They are on a mission to help patients. And it's our job to help them do their job, not to care about admin work. Come on.
I think, as you said before, you're so busy that you forget to do the things that you're going to, I need to go back to that computer and put that in there. It's got to be mobile, it's got to be agile, it's got to be there in the moment. I think sometimes as well, when the NHS, we don't have a lot of time. You know, I can't go and sit at a desk for 4 hours and do something. You're constantly buzzed by patients or staff, or you've got sickness and you're having to jump in. And I think that agility around the NHS and healthcare is absolutely key, not just for hospitals, primary care, everybody else would just head down running at 100 miles an hour. And I think sometimes you don't get the ability to stop. So it's how you can make that technology fit that practice, I suppose.
Yeah, thank you. Technology is not always the answer, and we had to go beyond IT. And because we've used the service design approach that we contracted at the beginning, I said it's not going to be easy work. It's going to go beyond IT. We got, are you okay with us challenging the processes that you're using right now in your programs? He said, yeah. I'm sure you weren't aware you were signing up for. So what we came up with this as the solution here at the end of discovery was a set of improvements, both on data, how can we improve the data flow, but also on the processes. How can we alter the ways of working right now? Of course, we don't want to share everything here. These are 4 personas that were affected by our changes. So there was Mary. That's our Jane. We've changed the name because we know that at some point it will be someone else in your shoes. So we want to check the perspective. Amy, tobacco treatment advisor in hospital, pharmacist, and substance misuse advisor. So these are the people we've talked with representatives, and I will share some of the findings in a minute, of course. So lessons learned. What was hard for you here? So the scope changes. That's on you and your team.
Definitely. I think as you learn more, you want to do more, don't you, as well? And can you just add in and can you just do? And this is really exciting. And I think you've got to be careful so you don't go down little wormholes and you think, I've gotten back to it, looks really interesting. So yeah, we are a bit guilty of wanting to change our scope and do more. Yeah, definitely. I always have this contract with my clients. I said, okay, you have a wishful thinking, and I'm the one who's responsible for saying, are we still on the budget or not? I feel like you were like my husband. He's the same. Can you stay on budget? I'm like, no. So the idea here is always to allow your stakeholders, to allow your sponsors to have this wishful thinking, because it's not their job to hold themselves. It's your job to write things down and check whether and when can we do this. How can we make it as a priority? Because if you don't have money, someone will have. Yeah. So and I think there's something about understanding that as well, isn't there? Around is going with the blue sky thinking and then bringing it back down. Because obviously you might have some really good ideas in that time as well. So go as big as you want, but then you've got to kind of come back down to earth with a bump and go what you can afford, or can you do it in part, or can we do it in stages or phases? And sorry, Chris, just do it all. Just do it all. Yeah. And also, it's our job to hold them, to say, it's not the right time for it. Because we have this idea, this strategy to go with this step further in the process. Not now. There will be a better place for it. And of course, that was especially painful for Agnieszka, the business analyst on the project. The teams were not capable to tell us what's the name of the IT system they were using. For them, it's just EPR. They don't care whether how it's called. They don't know how it's called, the system they put information in. They just get this icon, they log in somewhere. They don't care. And this was really, really, I understand because I don't speak IT, but as an IT company, it's very important for us to understand, okay, what are we dealing here with? And the question is,
why are we so heavy on systems and our users are not? Because it's not important for them. Does it get the job done? Yes, no, thank you, good enough for me. What was surprising for us, so first of all, being agile. I believe that we did it quite agile way.
Everything was agile.
Yeah, everything. It's like we tried, okay, is it the right approach for the workshop? Yeah, we'll do the first one, we'll check how it works. It was genuine. We'll check how it works. Second, we really were working together with the whole team. I remember that people were trying to make their way to the different workshops because they knew that there's some cross-section with different stakeholder group, and they wanted to be a part of the discussion. Because what we did, we allowed people to start different conversations and be a part of them because we really heard them, which was really, really nice. And bringing value through online project. And I'm completely aware that people right now, after COVID, we are all eager to meet in person, meet in flesh. Even this conference is like, we came here, we see a value in coming here. However, we wouldn't be able to deliver this project if it would be offline, because it would cost so much money to bring people overseas, because we are based in Poland, and the project was regarding NHS. Important information, I think. Yeah. So we did it all online, which is really good because we were able to, as I said before, to address the issues in a way mostly convenient for your team, for the stakeholders, for the actors, for people who are participating in workshops.
I think that's where we got buy-in as well from people wanting to be involved, because if you've got to travel somewhere, that's for me to come here today, it's a day out of my job. Whereas if it was just an hour in a Teams meeting, more people are likely to sign up to that as well.
Yep. I remember our conversation with Nicola. She was a project manager at your side, and we told her that we want our participants to be present at the workshop like for 4 hours for a full day. And she said, no, it's going to be hard. But once we get the word out there, everyone was so eager to participate. And people were like, okay, so I will change my shift, so I'll be able to go there. People were dialing in between patients, trying to be a part of the discussion because they had this unique opportunity to share their perspective, which is very, very nice. I think that it was mentioned. I think it was mentioned many times today and yesterday. It's good to have problem addressers as a group, as a stakeholders together, because we were having discussions on and on along this whole project, which was very, very nice. Because I'm not the specialist of Jane's management process. She's the expert. I'm the stupid one in the room. I'm asking all the stupid questions. I'm challenging. She's challenging me. I had this idea that I always try to contract with my clients. I'm not your partner, I'm a sparring partner. Remember? I was like, we're going to spar. I'm not going to agree everything to say, and you don't have to agree to everything I say.
That challenge is really important, though. It's really challenging your views or your vision or what you think. Sometimes you might think just because you've done a process a certain way that it works, and you would need somebody to put that challenge into you to make you rethink, is that really the right way to go?
Yep.
So that challenge, being that critical friend, is really important.
It's very important to show our perspective as a UX designers, as designers, is to build value and bring value through friction between different roles, different levels of organization. My previous boss has this saying, I think it died. Yeah. This one died, sorry. Has this saying of, so shall I use this one? Okay, so I have to avoid this one. Yeah. Does it your work?
Right.
Yeah, it works. Great. So every time we finished the workshops or some meeting, and he was like, "Were we fighting?" No, it was not a good meeting. So we have to redo the meeting because people have to fight over things that are important. If they don't fight, if there is no friction, it's not important enough for people who are at the meeting. Few takeaways. I know I'm going quite fast by just being aware of time. I know that we all want to hear the last presentation. We know we want to do it one by one. It's going to be very, very heavy on our attention. So sorry for that. Key takeaways. Look on both sides of process, service of product. This is service design approach. Look holistically, check everything, look around for improvements and problems. So the idea here is that Jane perspectives is different than your teams. By then this was data specialist on your side. And we were discussing patient journey, and then it was always like, what's the data flow? What's the IT system? How do they log in? Where do we get the information? And we're like, that's not important right now. He said, yes, it is. So we had to redo the session because it was important from his perspective. And of course, it brings value always, doesn't it?
Yeah.
And again, collaborate, co-design, co-research, and get your stakeholders on board always. Include stakeholders into the process. The more they are the part of it, the better they understand the findings and solution. And I think that you illustrated quite nicely, because you being here and adding your value, and I hope you'll get all the questions really to answer. And of course, the more you invest in engaging stakeholders, the less you have to invest in convincing stakeholders to invest in your project. Because if I come to you, if I would come to you and say, okay, I mean $1 million to do something, you said, it's not going to happen. But you know what's the problem. You know that's more than one, and you know that's the tip of the iceberg, don't you? The break silos. I think I'm really happy that we don't speak about silos so often here, but they are still in our organization, don't they? We just tend to overlook them. So we need to break silos to look holistically and see it all. It's our job to see it all. It's our job to pinpoint, to put difficult questions, difficult insight on the table. They might not be comfortable, but still it's our job to put it out there and discuss, to engage with the different discussion. Okay, so that's all from our perspective. I know it was a lightning talk rather than a speech, but as I said, we're more open to just start some discussions and answer questions. That's more valuable. Yeah, thank you.
I have a quick question. So my question is around, how did you manage, the power dynamics with having, the program manager in the room during a workshop, back to your statement of this tendency of do it my way. And, you as a program manager, if there are some ideas you have already and you have the stakeholders trying to say something and you're trying to say something based on your own assumption, how were you able to control, that tendency to avoid bias, in the kind of conversation going on during the workshop?
Yeah, it's a definite challenge, isn't it? When you know the process inside out and not have a bias within that. I think the main thing is to sit back and not say anything for a while, put yourself on mute and let the conversations, flow. And really, I think being a leader, you've got to be a listener. So you've got to be able to hear what's being said. You've got to be able to hear other people's voices in the room and then take some kind of direction from that, as well as understanding the process. So I think, and these were really good at challenging me and saying, but out, or, just be quiet for a minute, let somebody say something, or whatever that was needed. I felt like we created a relationship where we were all one team. So we didn't come with any hierarchy. There was no kind of, I'm leading this. It was very much an open session. And that's the kind of way I manage as well, though. We might have titles, but it doesn't mean anybody's any better at doing the job than anybody else. So I think it's important that everybody's got that same function when they come into the room. They've got the same amount of voice as I have. So, but sometimes just sitting on my hands and keeping on mute helps.
Yeah, we had this contract that I can mute Jane wherever I needed to.
You did. I don't think we actually used it,
yeah.
Or maybe once.
Once.
Yeah.
I've got a question. I work for Objectivity. I'm the director of healthcare services, so I'm a bit conflicted here.
That's a setup.
It's a setup. It's a set question. But I think we need to thank Jane, though, for your leadership, but your willingness to be challenged as well. You've said that a few times today. I used to work at the Department of Health, and we used to have. I hope if there are any doctors in the room, you'll hear it anyway. But sometimes you get the clinicians who think they know the patients better than the patients know them. And sometimes it's hard for them to be challenged, even though that is the right thing to do. And I think, Jane, you've always been very approachable about this. And I think the product at the end of it is better for that. And I think you can see the rapport these two guys have got here, you know, and that really sort of permeates through. But that starts with you, Jane, to let us challenge you. So thank you for that. That's a refreshing change. Thank you.
I want to just echo that sentiment because that's exactly what I felt sitting here watching the dynamic. And just for the virtual audience, I'm sure you would appreciate this, but I was privy to Chris and Jane actually meeting in person for the first time out here in the foyer during lunch or just before lunch. And if you kind of take that as the backdrop to what we just saw, I think, Chris, you guys got lucky with Jane. I think if I had clients like that, I'd be so happy. But enough of my waffling. I have a question for you guys from Ricardo. How do you do good enough UX research, taking into account constraints such as low budget and lack of stakeholder time? And then following that up, what is the ideal number of people to build a journey map within these constraints?
Okay, so it's a tricky one because good enough will be a sum of different actions. So first of all, you have to decide as a designer, as a lead facilitator, what is good enough. You have to contract with a main stakeholder that we won't do perfect. Heads up is very, very important here. So that's one thing. Two, you have to have a backlog of questions and information you need to gather. I like to use a tool called information map. I just map up the things that I know, what I don't know, why I need to know, who has the information, how do I get it, what questions do I ask, and what's the method I'm going to use. So that's the start with a project manager, with a stakeholder asking, okay, this is what we need to get to know. And that's one thing. The good enough is when you ask one person, one workshop, and you get back to play it back to the stakeholder saying, okay, so do you feel that we can move forward or do we still need to begin to do something? So it's rather a conversational equation here. It's not like I know or Jane knows. That's it's good enough. It's I feel that we can move further. And Jane says, okay, I'm okay with that. Because at the end of the day, she's making decisions. I think I'm being quite disruptive here. I try to repeat myself on everything, every occasion I have. I'm not here to make decisions. As a designer, I am here to ask questions. I am here to show options, but I'm not here to make the tough choices. She is. She has her skin in the game. I hope so. Or the good point, of course, so for the promotion, not for the. So the idea here is to talk, to conversate. It's always an option. It's always an answer. That's one thing. And the second question was about number of participants, right? I'll start with one. Start with one, build with one, check with another one. So it's not that like you have to start with building, okay, I need like focus group, like I need 5 to 7 participants, and then I need to, people don't know how to use customer journeys. And the workshops, on the video, you were able to see it on the movie when you replay the recording here. They don't know how to use step-by-step approach. Participants don't know how to do it. We know how to do it. You know, okay, you have one step, next step, where you can then rearrange them. What I do, I get, okay, what happens before the service? Before you meet the patient, what do you do? What do you do when we are with a patient? What do you do when the patient is already gone? With a bunch of sticky notes. And then the next step is, okay, let's organize it. So you can do it with one person, the same exercise. Then when you say that's good enough, we can move forward. And because you already have some less ambiguity in the project, you already know something, can we move forward? If you don't, we can always recommend let's check it with someone else. Let's take another user and then replay the session. That's the iteration, and that you start small and it's a snowball effect. Yeah, I think I think that answers the question.
But I think from my perspective, I think the other thing is use the person you're working with. So I know who I want in that room. I know I can leverage people to get in that room. So I think don't always, use the people you're working with to make sure the right people are around the table. It doesn't have to be on you.
Yeah, my question is, where can we find more Janes?
Lots of people are asking that in a minute. Yeah, thank you.
I can answer that. I brought here for a few reasons. First of all, I really want to meet her in person. That's one information. Second of all, I know it's hard for us to convince people to be more open-minded, where we come to design, whatever design is. The third thing is, I wanted everyone who is the participant of this conference to be able to show Jane to your stakeholders, saying, look what happens when you get involved. Because I believe in leading by example. There's amazing TED talk, How to Start a Movement. It's not about starting a new movement, it's about being a follower. So where to find new Janes? I think you have to show Jane, and that will open a lot of doors. Trust me.
Great. So again, thank you very much. That was such an insightful way to represent the entire process to the entire team. Well done.